Welcome to the 177th day of the Swasthya 365 days project. Today we are going to discuss about the risk factors and symptoms of anemia. Anemia can occur in all people of ages, sexes and ethnicities. The following factors increase the risk of developing a form of anemia. If have been born prematurely, being between 6 months and 2 years old, menstruating, being pregnant and giving birth, having a diet low in vitamins, minerals and iron, regularly taking medications that inflame stomach lining such as brufen, a family history of inherited anemia, sickle cell anemia or thalassemia, having an intestinal disorders that affects the absorption of certain nutrients and minerals such as Crohn's disease, loss of blood due to surgery or trauma. For example, a patient having a chronic illness such as AIDS, diabetes, kidney disease, cancer, rheumatoid arthritis, heart failure or liver disease have more risk factors of getting an anemia. Now, we are going to see about the symptoms of anemia. Symptoms of anemia may vary according to the type of anemia, underlying cause and severity and the health problems such as hemorrhaging, ulcers, menstrual problems or cancer. Specific symptoms of those problems may be noticed first. The body has also a remarkable ability to compensate the symptom. If your anemia is mild or has developed over a long period of time, you may have not noticed any symptoms. Symptoms common to any type of anemia includes the following: easy fatigue and loss of energy, usually rapid heartbeat, particularly increased with an exercise, shortness of breath and headache, particularly with an exercise, difficulty in concentrating, dizziness, pale skin, leg cramps and insomnia. The other symptoms may be associated with specific forms of anemia. First of all, we are going to see about the anemia caused by iron deficiencies. People with iron deficiency may experience these following syndromes: a hunger for substances such as paper, ice or dirt. The condition is called as pica. Upward coverage of nails refers to as cleonochitis. Soreness of mouth and cracks at the corners. Anemia caused by vitamin B12 deficiency. People whose anemia is caused by a deficiency of vitamin B12 can have the symptoms: a tingling, pins and needle sensations over the hands and feet, loss of sensation and touch, wobbling gait and difficulty in walking, clumsiness and stiffness of arms and legs, and dementia. Anemia caused by chronic lead poisoning. Chronic lead poisoning may include the following symptoms: a blue back line on the gums referred to as lead line, abdominal pain, constipation and vomiting. Anemia caused by chronic red blood cell destruction. Anemia caused by chronic red blood cell destruction can include the following symptoms: jaundice, brown or red urine, leg ulcers, failed to thrive in infancy, symptoms of gallstones. The most important hallmark of a jaundice is yellowing of skin and eyes. Sickle cell anemia. Sickle cell anemia is a genetic disorder. Symptoms of sickle cell anemia may include fatigue, susceptibility to infection, delayed growth and development in children, episodes of severe pain especially in joints, abdomens and limb. Anemia caused by sudden red blood cell destruction. Symptoms of anemia caused by sudden red blood cell destruction include abdominal pain, brown or red urine, jaundice, small bruises under the skin, seizures and symptoms of kidney failure. Call your doctor about anemia Talk to your doctor if your risk factors for anemia notice any signs and symptoms of the patient anemia following: persistent fatigue, breathlessness, rapid heart rate, pale skin or any other symptoms of anemia. Seek emergency care for any trouble breathing or changing in your heartbeat. Poor diet or inadequate dietary intake of vitamins and minerals. Very heavy menstrual periods. Symptoms of ulcer, gastritis, hemorrhoids, bloody or tarry stools or colorectal cancer can also cause anemia. Concern about environmental exposure to lead and hereditary anemia runs in the family, and you would take a genetic counseling before having a child. For women considering pregnancy, your doctor will likely to recommend that you begin supplements, especially folate, before conception. These supplements can benefit both mother and baby. Thank you.